Hi, welcome back to Destinygotsleeved, where we discuss this wonderful journey that is weight loss surgery. So today's topic is, how do I find a doctor? Well, I'm going to give you step-by-step information that you can use to choose the doctor of your dreams. Stay tuned. So number one, you want to find an accredited provider, okay? So I would check the website below. It's called the American Society for Metabolic and Bariatric Surgery. So in order for a surgeon to be qualified, they must be in good standing with the American College of Surgeons, and they also must review their requirements and certifications every 2 to 3 years. If you're looking for a surgeon outside of the US, the same accrediting body does have a separate distinction for international clinics. So even if you want to go to Mexico or somewhere else, you can still look it up to make sure that that facility has been accredited. And so you can search by country. You just want to go to the same website, and the actual letters that you're looking for behind your surgeon's name is MBSAQIP. That is Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. This ensures that the facility is using approved procedures, have adequate facilities and surgical experience to increase your chances of safety. Number two, you want to call your insurance provider to ask them about the requirements for bariatric surgery and also approved in-network doctors in your area. So there is going to be a variety of requirements depending on the insurer. However, for most insurance companies, they're going to require that you have a BMI, body mass index, more than 40, or if you have a BMI between 35 and 40, you have to have some sort of comorbidities. That means like high blood pressure, diabetes, sleep apnea, or anything else that can make that put your health at risk. So the sample requirements, if you're going to go through insurance, are things like psychological visits, nutrition visits, your primary care doctor, labs, tests, as well as a percentage of your hospital stay. Number three, now it's time to start calling for consultations. Yay! So you'll take that list, and I can't tell you how many doctors you'll need to speak to in order to feel comfortable. Personally, I went to 3, but if you go ahead and call over the phone, a lot of times they can answer most of your questions over the phone. You can also decide to go in person, that's fine too. Some surgeons do require that you pay a consultation fee. Personally, I would say keep that surgeon for the end, because you don't want to have to spend $200 or $300 on a consultation when that person wasn't a right fit for you and you found someone else anyway. Number 4, questions to ask at the consultation. How many years have you been practicing bariatric surgery? How many cases in the past 3 years? So here you're looking for someone who has completed at least 200 surgeries. Data shows that complications are much lower for surgeons who have completed at least 200 to 300 surgeries in the last 3 years. Number 5, I'm actually going to put a short list of questions right here so that I can help you get started. I'll also put a little document below so that you can download at your leisure, just to give you some tips on what to ask. So some of the questions are, what are the reasons someone should have weight loss surgery? What will the scars look like? How much pain will I be in after? What surgery would you recommend for me? How long would the surgery take? How long would it take to heal? And what kind of risk are there with each option? Another one is, who will administer the anesthesia? Once again, this is especially important if you're thinking about having your surgery out of the country. You want to ask who is going to watch you while you're under anesthesia. How much weight will I lose? How fast? And how long will it take me? How will my eating change after the surgery? Do you have a required diet program? How long do I need to be in the hospital? How long should I take off work? What can I do before surgery to lower my risk of complications? Next, what type of post-diet can I expect and for how long? And also, what medicines will be prescribed to me prior to my surgery? Communication and travel. So no matter what city or country you decide to have your surgery in, make sure that their offices are available before, during, and after surgery. It is so important. Ask about if you're thinking about doing something out of state, or maybe you want to travel for your surgery. Definitely ask them about teleconferencing, future plans. If you know your surgeon's going to be out of town during a certain period, or if they know that your surgeon has his birthday or something coming up. It happened to me. And also the location of partner doctor's offices in your area, just in case you have some complications after surgery. Also ask for the direct contact information for your surgeon's physician assistant if they have one. That's a PA. They're able to write prescriptions, and they're able usually to get to you faster than your surgeon can. If you must choose a surgeon that is not in your area, I would suggest locating one that's within driving distance. If you cannot locate a doctor within driving distance, then okay, you've got to do what you got to do. The only thing I want you to keep in mind is that you may need to complete multiple appointments prior to your surgery. Now, I know that if you do it out of country, they don't require as many appointments. However, you would still need to get your labs, your tests, and some other things done here stateside before you travel there. And those additional costs may or may not be covered by your insurance. So you definitely want to ask that specific information. Now, I did find that even though I did not use my insurance for my gastric sleeve surgery, that my insurance company did offer some sort of travel repayment for any surgeries that I had to seek outside of the state. So that may be something you can look into. Definitely ask them, hey, even if I can't get the actual surgery covered, maybe you can help me out with the travel reimbursement. Number 7, payment options. Okay, so there's generally 3 different ways to pay for it. You can either do cash pay, which means that you can use a lender like carecredit.com or any other medical lenders. Usually you can just type it into Google, medical lenders that can give you a loan for it. The other option is Medicaid, of course, if you're already approved on that. And you also have private insurance that you can use. Now, for me, I decided to go with self-pay. Self-pay was because I like the speed of it. I think from the moment I found my doctor till the moment I actually was on the surgery table was about 8 weeks. So once again, that was my choice and what I decided to do, just because I wanted to do it while I still had the nerve. Now, keep in mind that if you are thinking about having your surgery overseas, you want to make sure that you also purchase travel insurance, because you don't want to be held responsible for the cost of any airfare or hotel when there are unforeseen circumstances. And in 2020, there is nothing but unforeseen circumstances. Number 8, you want to find some real patient reviews. Now, you can always go to the website for the surgeon, and of course they're going to say, oh, this is so wonderful, and have all these wonderful tales. But you also want to follow up and see if your doctor is listed on the Better Business Bureau website. If your doctor has multiple complaints from multiple patients, I'm not saying they're 100% right, but I would take it with a grain of salt and kind of put that in the back of your mind. I would also check some of the following websites: healthgrades.com, vitals.com, WebMD, and Real Patient Ratings. So use one of those resources. I'm not sponsored by any of them, so it's up to you which ones you want to use, but I would definitely take a look at that, okay? And number 9, you have to sit back and ask yourself, how do I feel about my doctor? How do I feel about the doctors that I have seen, and how comfortable am I? When I was asking my questions, was he or she listening to me? Were they empathetic? Did they have answers, or did they rush me along? Did they seem like they were too busy to answer the question fully? Did you have to continue to prompt them? You want to know what you're dealing with, because after surgery, you are going to be weak and you are going to be groggy. And if there's anything that happens, in the days after surgery, after you're discharged from the hospital, you want to be comfortable enough to let them know what's going on. And you also want to know that they are going to be responsive to your needs and attentive to the concerns that you're bringing up. So, I hope that you found this helpful. Remember to click subscribe and like below. And I'll see you next time, okay? Bye-bye.